you briefly tell us a bit about your story and your diagnosis of sarcoma?
My story begins when I was 11. I was diagnosed with rhabdomyosarcoma in my left calf. It's a very aggressive form of soft muscle cancer, and I received 14 rounds of intensive inpatient chemotherapy in addition to radiation and surgeries, and was declared cancer-free. And for about 1.5 years, my life went back to normal. I was playing softball again, hanging out with my friends, but unfortunately, shortly before my 14th birthday, I relapsed, and the doctors told me at this point the only option was amputation. So 10 days before my 14th birthday, my left leg was amputated above the knee, and I received another 3 months of chemotherapy. Around that time, during a routine body scan, they discovered chondrosarcoma in my fourth right rib, which is a cancer of the bone, and they removed the entire rib and a portion of my lung as well. And I made it through most of high school cancer-free until my senior year. A lump appeared in my abdomen, and it looked like a cyst, but when the doctors tried to drain it, they couldn't. When they removed it, they discovered that it was my third type of sarcoma, leiomyosarcoma. And we learned shortly thereafter that these were all caused by a rare genetic disorder called Lee-Fraumeni syndrome, which means that my tumor suppressor gene doesn't work properly. And I've actually had 2 additional cancers, including clear cell carcinoma in my kidney at age 23 and breast cancer at age 27.
Can you describe your role to us and what it took for you to get there?
In 2016, I made a difficult decision, which was to leave my job fundraising at a nonprofit to go back to school for my master's in social work. And I went back to school with the idea in my head that I wanted to work with adolescents and young adults with cancer. Having been both treated in a pediatric and an adult hospital, I knew what it was like to feel like you didn't belong there as a patient. As a teen, you're almost too old for pediatrics, and as a young adult, you're almost too young for older adult care. You go to clinic, you go to the hospital, and no one looks like you. There's no one your age, and you feel like you're alone. You feel isolated. So I went back to school with the hopes that I would get to work with this population and help them through this difficult time. And I'm lucky enough now that I work at Yale New Haven Children's Hospital as the adolescent, young adult, social worker, and program coordinator. I get to do fun things like movie nights and game nights with teens and young adults, but I also am trained to provide emotional and psychological support for them as well.
Do you think your past cancer experiences help you in working with this population?
I think my experiences with cancer definitely helped me in working with this population. To be able to relate to them on such a unique and personal level, to say, hey, this sucks, I know, I get it, I had all my treatment here when I was your age, can really make a difference. Oftentimes they're feeling already so isolated from their family and friends who they feel don't understand what they're going through. And having someone who's around their age who maybe looks a little bit like them come up to them and say, I know what this feels like, can change their outlook, even if just for a second. As teens, we naturally kind of self-isolate because so many of us feel uncomfortable in our skin and misunderstood. And you throw cancer on top of that, and it leads to all kinds of adverse effects, such as an increase in isolation and anxiety and depression. And I'm able to step in with my training and knowledge and experiences and help them through their battle with cancer. And not just that, but because I've been through this and I'm from the area, I'm able to provide information on local and national resources that will help them through.
Is there a piece of advice that you may have learned when you're going through treatment that you would like to share with any patients?
If I could share one thing with patients, I would say that it is okay to ask for help. When we're teens and young adults, we're just trying to gain our independence. We're just starting to feel like grown-ups. And I know that I felt that I often had to fight my disease alone. I didn't want to be a burden to my family and friends, so I spent so much of my battle with cancer fighting it by myself because I didn't know how to ask for help. I didn't know how to accept help. So I think, for me, I learned pretty late that it wasn't weak to ask for help. It didn't make me any less strong as a person. And once you let them in, my support system was amazing. And they can come in any sizes, shapes, forms of people, family, friends, doctors, teachers, nurses, professors, whoever you have in your network. It's okay to ask them and reach out for help.